Hi there, my name is Alexis, and I did my PowerPoint on COPD, so I'm going to go ahead and go over it with you. Hopefully this will do. Okay, so COPD. What is COPD? So COPD stands for chronic obstructive pulmonary disease. The term refers to a group of diseases that blocks airflow. Breathing conditions such as chronic bronchitis, emphysema, and asthmatic bronchitis all fall under this umbrella. And the Centers of Disease Control and Prevention suggests that COPD is the fourth most common cause of death in the United States. So basically, I chose this topic because, for one, I work for a few pulmonologists here in Fresno that are very well known. And one of the main things that we see patients for today are COPD. And a lot of them have been lifetime smokers. Some of them may not have even smoked at all. But the fact that it is such terminal illness and it's very serious and people don't think it's as serious as it really is just kind of struck me to maybe do my presentation on it. So that's basically what it is. COPD affects the lungs, but it also can affect, if your lungs are affected, then basically air cannot travel to the rest of your body. So it'll eventually affect the circulatory system as well as the heart and the brain and things like that. So that's the first slide. So basically these are pictures of the lungs. This is your normal lung function. So this is what your lungs should normally look like. And these are lungs with emphysema. So there are types of COPD. COPD is usually the result or combination of the two conditions, which are emphysema, which is this, emphysema lungs, and chronic obstructive bronchitis. People who are diagnosed with COPD usually have both conditions, which is true. A lot of people that do come in the office for COPD usually have both emphysema and chronic bronchitis. Emphysema is the destruction of the air sacs, and chronic bronchitis, inflammation of the bronchial tubes. So signs and symptoms. Get a lot of this when we do our history in the report. So I usually have to ask patients what they feel, and they usually tell me things such as this. So most patients who have symptoms of COPD usually have those familiar with emphysema and chronic bronchitis. These symptoms include, but are not limited to, dyspnea, which is basically shortness of breath, fatigue, constantly tired throughout the day, lack of energy that they used to have. I've had patients tell me that they're so tired that they're finding themselves falling asleep at the wheel. Persistent dry or productive cough. Productive meaning when they cough up phlegm and things like that. A wheeze, so if they can often hear themselves when they breathe, or really bad after they cough. Phlegm production, and usually with COPD, the phlegm tends to be clear or milky white. That's one way to tell if they have COPD. And chest tightness or back pain. Sometimes a lot of the patients that we see, some of them, I've had patients that are 24 who come in and they have COPD who have never smoked before. And then I have patients who are older and have had back surgeries and stuff. So it's kind of hard to distinguish whether the chest pain or the back pain is related to a lung issue versus like a prior surgery or something like that. So causes of COPD. One of the main causes. So let's see. In developed countries like the United States, the single biggest cause of COPD is cigarette smoking. About 90% of the people who have COPD are smokers or former smokers. Among smokers, 20 to 30% develop COPD. In addition to the cigarette smoke, clear cigar smoke, pipe smoke, and secondhand smoke can cause COPD. Your risk of COPD is even greater if you have asthma and smoke. So if you have asthma, or if you had adolescent asthma and you start smoking and you've been a persistent smoker, your risk of getting COPD or being diagnosed with it later on in the future is pretty high. Exposure to things such as gas, fumes, dirt, dust, mold, or asbestos also puts you at risk of COPD. So smoking is not just the cause. If you work in construction and don't wear a face mask, my husband works in construction. He's also had asbestos exposure that also sparked his asthma as well. So you have to be really cautious if you work in a field that you have exposure to these things. Make sure you take the proper cautionary procedures and protect yourself against this, so you're not at risk of getting COPD or anything related to it or alike. So there are different stages of COPD, and here there are different lung pictures. So this is stage 1, stage 2, stage 3, and stage 4. And you can kind of see in these pictures the lung function. Stage 1, you still got some. Stage 2 is about 50%. Stage 3 is about 75%. And stage 4 is about 90% of your lungs are not working. And there is a diagram of people, or a percentage of people who currently have COPD now. So about 29% of citizens have COPD or have been diagnosed. 28 have chronic bronchitis. Emphysema is a 37%, and 11 is diagnosed or undiagnosed, excuse me. But a lot of the times, like my pulmonologist says, a lot of the times COPD can often be misdiagnosed. We've had patients that come in who think they have COPD, and they actually have sleep apnea, which is another big trigger to this. Sleep apnea is a total different subject, but still, a lot of physicians or primary care physicians almost always mistake COPD for sleep apnea, or sleep apnea for COPD. So when they come in, we can't diagnose them right away without doing proper testing and pulmonary function tests, blood tests, and things like that. So once again, the stages and groups. This would be related to stage 1, which is mild, and then so on and so forth. So stage 1, stage 2, stage 3, and stage 4. Mild, it's mild air limitation, often complaints of dry persistent cough with some phlegm production. So often people come in and they have the early stages of COPD, and they just come in with a cough. So when they come in and we catch it early on, we're able to treat it a whole lot better versus somebody who came in with very severe COPD. Moderately severe being air limitation will worsen, increase cough and phlegm production with severe symptoms, with some symptoms such as dyspnea. Severe, so with moderately severe, they'll have all the symptoms of one, but they'll often feel a lot more shortness of breath. Severe is breathing begins to decline. Symptoms such as cough and wheeze begin to worsen, and fatigue may occur. They're coughing so much, they're wheezing, they have shortness of breath, that it's causing them to be overly exhausted and tired because their body is just working so hard to try to breathe, and it's just not working due to the COPD. Very severe breathing difficulties can be life-threatening, and airway blockage can affect the circulatory system. So at this stage, it's so bad. The majority of the patients who are coming in with severe COPD probably often already have oxygen. Their oxygen saturation is probably as low as 86. I have seen some that are like in 78, which is really bad. You're supposed to have 100%. And at this point, they need oxygen. They need to constantly be on some type of like prednisone. That's one of the treatments. Maybe 2 to 3 inhalers, things like that. So treatments for COPD, inhalers is one of the main things. So inhalers, for one, the person should stop or quit smoking, or try to at least. Otherwise, I mean, it's just not going to happen. Medication, so like I mentioned, prednisone is one of them. Singulair is another. Those are types of medications that can often help the wheeze and the shortness of breath. Inhalers, inhaled steroids, combination inhalers, oral steroids. Let's see, antibiotics, lung therapies. Lung therapies meaning things such as a nebulizer, that's a lung therapy. So like they have to breathe in the solution, and that's about a 15-minute process. So that would be a lung therapy. And last but not least, a surgery. So like a trach or something like that. That's something that'll eventually happen in the severe stages. Living with COPD. So people who have COPD have to take cautions. A lot of the things that really bugs them is that they have to do things a lot slower than usual. I've had patients who were used to walking a full mile or a mile and a half in maybe 30 minutes. Now they have to take maybe 45 to an hour to walk that, because they have to take it slower and take more caution and kind of, breathe. We like to joke around and be like, hey, you got to take time to smell the roses, or, look at the view. And so, we try to keep them looking on the bright side of things. They have to keep up and get ongoing care, constantly getting refills on their inhalers, on their medications, keeping up with their appointments. One of the things with COPD, they have to get an annual CAT scan of their chest to see if they're progressing or not, things like that. So they have to keep up with their care. They manage the disease and symptoms, so they're in charge of the disease and their symptoms. It's their responsibility to stay away from people that are secondhand or that are smoking, so they're not exposed to secondhand smoke and things like that. And then just prepare for emergencies. Always have your albuterol, your emergency inhaler, and things like that. If they feel really bad tightness in the chest, or they just cannot catch their breath, they know that they need to go to the hospital and get admitted, so they can go ahead and take further action. And that's it. So I hope this was very informational for most of you. If you have any questions, you're more than welcome to get in touch with me. My daughter. So excuse me.
When you go away.
Oh, I'm gonna miss you too. So I hope you enjoyed that, and thank you very much.